Hello, I'm Dr. Stan Yeatts, board-certified OBGYN physician with over 30 years of experience. I've observed countless moments of happiness in the journey to parenthood. I want to review a topic that's not part of common conversation about fertility. Sometimes donor eggs are necessary to build your family. Couples may be concerned about the legitimacy of their parental relationship. They may ask, "Is this baby my baby?" The answer is a resounding yes. The experience of pregnancy, birth, and nurturing creates bonds that go far beyond genetics. Building a family through donor eggs may be necessary for a number of health reasons. It can be a complex and emotional process. Health professionals should recognize this need to offer support with sensitivity and compassion. As Stork Advisor, we empathize with the numerous circumstances that prevent women from natural conception. Carefully screened donors aged 21 to 34 years of age are considered. These young women undergo rigorous screening. In fact, less than 5% of applicants qualify. They must be healthy, maintain a specific body mass index, be non-smokers, and have a clean genetic and infectious disease and psychological history. If you're a good candidate, hormonal ovulation stimulation is next. For recipients, a physical examination is needed. Standard testing includes evaluation of your overall health, your reproductive health, and your pelvic anatomy to ensure that you're a good candidate for donor egg in vitro fertilization. There are advantages with the use of donor eggs. There is a greater chance of successful pregnancy for women over the age of 40 with donor eggs. Reproductive medicine clinics report success rates of between 45 to 60% per transfer. Women over the age of 40 may have a 10 to 20% chance of successful conception with their own eggs. This option gives hope to so many families. But donor eggs aren't just options for women over 40 years of age. There are health conditions that make it necessary to consider donor eggs. One example is premature ovarian failure, which is essentially menopause at an unusually early age. Another example of women's health problems includes a diminished ovarian reserve, which may be a result of cancer treatment as chemotherapy or radiation treatment. Fortunately, there is hope for families and these women who did not choose the circumstances that they experience. There are benefits associated with donor egg IVF. Some of these benefits include increased success rates. Donor eggs can significantly improve the chances of a successful pregnancy, especially in women over the age of 40. Improved health outcomes. Donor eggs can reduce the risk of genetic disorders and birth defects associated with advanced maternal age. Their emotional benefits. Donor eggs can provide hope for individuals struggling with infertility and desire for parenthood. Look for the support around you, whether it's the dad-to-be, a friend, a family member, a minister, a counselor, or maybe even your medical professional. Don't be afraid to reach out and ask for help. We encourage you to surround yourself with loved ones and any professionals who want to help you realize your dreams of becoming a mom. Building a family is a complex process that requires perseverance and patience. There are countless individuals and families out there who have built their families using different options as assisted reproductive technology, adoption, or becoming a foster parent. Explore your options. You will not regret it. We can all learn from each other's experience and draw strength from each other's stories. That's why I encourage you to subscribe to our channel and share your story. You may also be encouraged by stories of others. At Stork Advisor, we are committed to creating a supportive and nurturing environment for women. Building a family is a journey that requires patience, love, and dedication. In life, our dreams are not always realized in the way that we imagine. However, with faith and practical steps, your dreams can come true. Well, this is Dr. Stan. Thank you for joining me today.